Chapter 40, Assisting in Pediatrics. So pediatrics is a specialty area of medicine that involves the care of children up to the age of 18. But in some offices, they do treat them up to the age of 21. So as an MA working in this field, some of the responsibilities can include parent and caregiver education, administering immunizations, and recognition of special health concerns. You also must have good relationships with children. And then developmental stages and care. So there is the physical development, which is the actual body changes that occur. Your intellectual cognitive development refers to the thinking skills that the child is developing. Psycho-emotional development refers to the changes in feelings experienced during a particular period. And then social development refers to the way a person relates to others. And then we have different, an age bracket. So they break down the different ages into different brackets. So you have your neonate, which is considered birth through 1 month. So physical development of that age bracket. Oh, I'm sorry. Neonate. I'm sorry about that. So they break down different segments of the children's lifespan into different brackets. So neonate would be birth to 1 month. So some of the physical changes that happens in that bracket would be usually the full-term baby is 40 weeks. Infants usually weigh between 7 and 9 pounds, and they are between 18 and 22 inches is the average. The head size is typically 1/4 the size of the entire child's or the child infant's length. So the head does technically look a lot bigger than the body. The head on neonates have 2 soft spots or fontanelles. They are the tough fibrous tissue cartilage. You can sometimes grab the baby's pulse from there, like you'll feel them up on the top of their head. You can grab the pulse there. The newborn skin is usually loose, wrinkled, and somewhat red in appearance. During the first week of life, that skin may start to peel. It's not harmful. Nothing needs to be done about it. This is just skin kind of shedding a little bit. And then you have that part of the umbilical cord that's still attached to the baby, or known as a stump. It will be there about probably 6 to 7 weeks, depending. And they're usually about 1.5 inches in length. And then developmental stages as well continued. So the infant can move his head from side to side. However, they cannot hold up their head without assistance of the caregiver. Newborn skin, we said that, I'm sorry. Infants may develop a condition called neonatal jaundice. So that is accumulation of bilirubin, which is the waste product from the normal breakdown of red blood cells. So they don't have that ability yet to break down the bilirubin, so their skin tends to be like a bit of a yellowish color to it. So they'll put them, I did have an image over here. It's called a billy blanket or a bilirubin tent. They put little glasses over the child's eyes and they lay them in the center of this machine here, and that blue light or that ultraviolet light will break down the billy on itself so they can stay there. Sometimes they do send them home with a billy blanket. The same kind of thing, they just wrap it around their abdomen. You can plug it into the wall and it does a UV light that way. And that way you don't have to go ahead and put the glasses on the child because it's only around the abdomen. With these ones, it's probably a really bad case of it, so they had to put the glasses on. And then infants can usually see objects within 8 inches of their eyes. Their protective reflexes are present. They have the blinking and then that Moro reflex, which is that reflex when they kind of flinch back in fear. It's kind of like they're falling. They kind of jerk back a little bit in quickness. Intellectual and cognitive and social development of the neonates. They will become calm when they are picked up and held firmly or swaddling. I kind of have an image of here of what the swaddling is kind of like. It's like the blanket. You have their arms and legs wrapped up kind of like a little burrito. They will respond to stimulation and they begin having their own activity period or pattern, which is eat and sleep cycle. So it does kind of help if you can get them onto a schedule of their each week in sleep cycles during the day, and it will help the child sleep throughout the night. So aspects of care. You want to make sure when you're bathing them that you are using warm water. Do not use hot and do not use cold. Their skin is more responsive to temperature than an adult. Breastfed or bottle feed infants. Parents must be educated on the feeding times, how much to feed them, when to feed them, if they can be waking up when to feed them or they can stay asleep. It all depends on the weight of the baby. So it's usually every 4 hours, but it honestly depends on how heavy the child is. Jaundice babies can get benefit from the breastfeeding. Parents should be taught about bowel movements and the proper way to clean after a diaper change. Boys are a little bit easier, but for girls, you have to make sure that you are wiping from front to back, not back to front. You don't want any of that fecal matter getting into the genital areas of the female. And then screenings for the rare metabolic disorder, phenylketonuria or PKU. This test must be done within 24 to 48 hours. They give the baby or the child or the infant these ingested proteins. And then 24 to 48 hours later, they'll do a blood test to see if those proteins are broken down. If they are broken down, then you are free to leave with the child. However, if they do the blood test and those proteins aren't in the blood test, that means that the child can't can't get rid of that PKU. So they do have to do another screening for it. So you'll see it here. You get a little small sample from their heel, and you put the blood drops here, and then 48 hours later, the protein will either not show up or will show up. Now you have your infants, which are 1 month to 1 year of age, are technically called infants. So the physical development, they can focus on objects about 3 weeks of age. They can follow or track an object with their eyes and make eye contact at about 4 weeks. They can track an object from side to side, bat at objects such as their favorite toy or rattle. They can possibly start stringing sounds together at about 2 months. They're not talking, they're just making sounds. They can respond to sounds by turning their head and looking as a way of noticing sounds. At about 3 months, they can tend to raise their head up and shoulders while on their stomach. You still have to hold their head, though. About 4 months, they can roll from their stomach to their back. 6 months, they can roll from their back to their stomach. Maybe retrieve a dropped object. Their first teeth may start to appear at this time frame, too. 9 months, they can start to sit up. They creep on their hands and knees in that army crawl or a full normal crawl. That pincer grasp, which is a picture down here, it's when they start to use their index finger and thumb may be used. It's more of a finger dexterity. They may be able to say repetitive sounds such as mama or dada. And then about 12 months, they use like the furniture to get around, to not to crawl around, to walk around. And then they should be able to take between 1 to 2 steps independently. And then the intellectual cognitive development. So about 1 month, they can make eye contact. 4 to 5 months, they start to recognize familiar faces, familiar objects. 6 months, they begin babbling. 9 months, they can play games, begin to understand cause and effect. If I'm in my high chair and I drop a toy, they know now to kind of look down to the ground to find it. 12 months, they can, follow simple directions like go get me a diaper, go get me your bottle, go get me this, and that. They can do simple instructions. And then I just to put a little tidbit over here, some of the physical, social, emotional, and intellectual cognitive between 6 and 12 months, which you can look at on your own time. And psycho-emotional development. So about 1 month, they can smile at smiling faces. 3 months, they can smile spontaneously and start to display pleasure in them making the sounds. 4 months, they can vocalize a mood. 6 months, they have the abrupt mood swings when they can't really control their emotions. 9 months, they can display pleasure in playing simple games. And 12 months, they can express many different kinds of emotions. So social development and aspects of care. 1 month, they can be able to smile. They can, at 3 months, respond to voices. 6 months, they should be able to start babbling. 9 months is the first development of real words. Infants need purposeful stimulation, so your physical contact, prompt attention to their needs. It develops a sense of trust in themselves with their caregiver. Breast milk and formula should increase to meet their infant's needs and ensure your infant's safety, to make sure if they're crawling around and walking that you do have all the outlets plugged in, anything that they can climb on or pull down on themselves that is put away, taken away, or baby gates, things of that nature for their walking and all of that. And then toddlers, so they're 1 to 3 years of age. Their physical development, usually between 1 and 2 years, the weight gains start to slow down a bit. Their arms and legs will grow longer than their trunk, and their head is in proportion to the child's overall size, so it starts to not be as big anymore. The girls reach about half of their adult height between the ages of 1 and 2. Boys reach about half of their adult weight between 2 and 2.5. Toddlers should be able to walk independently. 18 months, they can squat, kneel, and remain upright. They may be able to use a spoon to feed themselves. 2 years, they can throw a ball, run, scribble. 3 years, they're very active. They want to dress themselves. They can probably ride a tricycle, draw simple shapes. And then 2 to 3 years old is when you technically can start potty training them. That's when all their muscles are strong enough to be able to hold the urine in and have that control over their body functions. Intellectual development of toddlers, between 12 and 15 months, they can speak a few single words. 15 months, they enjoy looking at books. 2 years, the why question is constant. And then 3 years, they can repeat nursery rhymes, retell familiar stories that they know. And this little tidbit on the side is the average 4-year-old asks between 437 questions every single day. Psycho-emotional and their social development. So in their psycho-emotional, about 1 year, they can express many different kinds of emotions. 1 to 3 years, they start gaining more control of their emotions. 3 years, they become sensitive to other people's feelings. Social development. It's about 1 to 2 years. They're unlikely to be able to play along with another child. It's usually side-by-side play. And then 2 to 3 years old, they're able to kind of share and then play with other children. Aspects of care for your toddlers. You want to make sure you have opportunities to work on their fine motor skills. Make sure you are helping them with their writing, with their crayons, making sure you're talking to them so they can develop their language skills, using simple explanations to provide a positive environment, making sure you're setting limits and boundaries in relationships and behavior. At the same time, you want to the environment should not be one in which the child is constantly be told no. So you do give them a little bit of options, but making sure you do have boundaries with those. And then your preschooler, which is 3 to 5 years. So you have your physical development. Their respiratory and heart rate begin to slow down, becoming closer to that of an adult number. 2 to 7 years, the bones start to ossify or become hardened. 3 to 4 years, the nighttime control of the bladder and the bowel movements do start to happen. Intellectual development, between the ages of 3 years old, they should be able to speak about 900 words. 4 years, about 1,600 words. And 5 years should be about 2,000 words, and stories will become more detailed as well. So I do have a little funny thing over here. Congratulations, your kid is now potty trained. You will get to see every restroom of every restaurant, store, and park you visit. Your psycho-emotional and social development for your preschoolers. 3 years, they're very easy and pleasant. 4 years, that negativity starts to increase. 5 years, they're more self-assured, well-adjusted, and home-centered. Their social development. 3 years, they know what gender they are. 4 years, they're very social and enjoy playing simple games. And 5 years, they're very social, playing enjoys playing games with others, and following rules. Aspects of care for your preschooler. Immunization should be up to date. Your 5-year-old should receive a complete preschool developmental assessment and physical. Children start to come up with these delay tactics at bedtime. Night terrors are common in 3-year-olds. Nighttime routines should be important in helping in them feeling secure. So they're going to think there's monsters on the bed, things in the closets, making sure that you identify and, alert or identify their concerns. Come up with a routine so that they know they feel safe in their bedroom. Elementary school child is 6 to 10 years. Physical development, the girls are taller than the boys. The permanent teeth their permanent teeth replace their baby teeth. And then 9 to 10 years, their reproductive system will be developing as well. Intellectual development, about 6 years, they have a brief attention span. 10 years, they're able to focus for longer periods of time. And then 6 to 10 years, they should know the difference between right and wrong, fantasy from reality, honesty and fairness. Those concepts should be in a good development by that age. Psycho-emotional and social development. Your psycho-emotional, 10 years, they're more influenced by their peers and their parents. They start to grasp the concepts of time and distance. If you tell them to be home in a half an hour, they understand that concept that a half an hour is longer than 15 minutes and shorter than an hour. Social development, the appropriate social behaviors are learned, usually in school or by their parents. And then aspects of care. Structure is a must in this age bracket. Consistency in activities, discipline helps that child to develop intellectually, emotionally, and socially. There is a little tidbit on the side there which you can read on your own time. It's just kind of which outcome would you prefer. And then your middle schoolers, they are 11 to 13. So physical development, puberty usually starts in females between 12 and 13, but it can be as young as 9. 14 is usually in the males. So if you look at the diagram here, you see the female characteristics are in the lighter green. The male characteristics are in the darker green. And then the ones in the middle are the characteristics that males and females share. So you'll see for the females, their estrogen production is underway. Their mature eggs production begins. Menarche occurs, which is the onset of their menstrual cycle. Their breasts start to develop. Their hips will widen. Their shapes become more rounded. And for the males, testosterone projection begins, which means their sperm production begins. External genitalia start to grow. The wet dreams may occur. Their shoulders broaden. Their facial hair develops. They start to get that significant muscular development as well. And then the ones that they have in common, which they all are growing taller, they're all gaining weight. They do all have the body hair. Their voice deepens, boys more than girls, obviously. Increased muscle mass, and then acne. Intellectual and psycho-emotional development in 11 and 13-year-olds. Their physical growth and psychological growth changes are extremely high at this time. So they usually have less energy available for their academics. Psycho-emotional, there's experience a wide range of physical changes in learning the roles of their sexuality. Social, they're learning their own sexual identity. They may not be comfortable yet in heterosexual relationships. It doesn't mean they're not heterosexual. It just means they might not be comfortable yet with having boyfriends and girlfriends or whatever the case may be for that. The aspects of care for an 11 to 13-year-old, consistency is the key. Consistency and discipline is very important. Friendships and associations should be monitored to make sure they're hanging around with the right crowd. Parents should not be hypercritical. Yes, they're going to make mistakes. You don't have to always point them out every single time. Try not to make too many unreasonable demands. Overscheduling of the child's time should be avoided. However, you should have some kind of extracurricular activities. The physical development, the females attain their adult weight and height. Males do continue to grow in height until about 25 years of age. At this point, the girls have reached their menarche between 14 and 19 years of age. Males have those nocturnal emissions or their wet dreams. Intellectual, they often don't see the connection yet between behavior and consequences. So the psycho-emotional, they begin to develop their own sense of independence, personal identity, the peer pressure, anxiety are all part of the adolescent process. So the peer pressure says a lot of them, if you read a little tidbit, like 90% of teens report they would give up using their cell phone while driving if their friends did the same thing. 20% of teen girls feel pressured to have sex. So there's a whole bunch of different ones on there if you do have a child in this age bracket, just to be informed about. And then your social development aspects of care for your adolescent 14 to 19-year-olds. Those social friendships are very important. They need to spend time enjoying these friendships, going to sporting events, social events, doing things in school with other kids, making sure that you're aware of the problems with teens and eating disorders, substance abuse, STIs, suicide, and violence. Making sure for your aspects of care that the caregiver should listen to them, give them the facts, trust them. Set limits, though, but you also have to remember how you used to be and how you used to feel as an adolescent. So give them a little bit of a leeway with their moods and their comments. You have to remember how hard it was for you to go through that age bracket. Pediatric examinations, so your well child exams, should be done at specific intervals, 3 to 5 days after birth, 1 month, 2 months, 4 months, 6 months, 9 months, and 1 year, so 7 total. Checkups at their second year of life would be 15 months, 18 months, 24, and 30 months. That's between 2 and 3 years. And then from age 3 and above, they should have their checkups about every year until they get to be 21. Then your pediatric immunizations, so your vaccines is to protect susceptible individuals from infectious diseases. They're given to them to reduce the susceptibility of the host to the infection. You need to schedule the appointments and the follow-up visits based off of whatever your office's vaccine schedule is. But this one I found, it's pretty much up to date, even though it says 2019. It's the immunization schedules from birth to about 6 years old. So at birth, you're going to be getting your Hep A, and then you'll get it again at 1 month and 2 months. And then anywhere between 1 and 2 months, you can get your rotavirus, which is the liquid for the gastroenteritis, your DTaP, your Hib, your Prevnar 13, and then your IPB, which is for your polio. And then at 4 months, if you haven't gotten, you get your second dose of the rotavirus, your DTaP, Hib, Prevnar, and IPB again. 6 months, you can get your Hep B for the third. You can get your third dose of the rotavirus, the DTaP, the HIV, and the Prevnar, or the meningococcal virus. And then it kind of varies between 6 months and 18 months. Usually between 12 and 15, you'll get your HIV, your last Prevnar if you haven't gotten it yet, your IPV. Your influenza can start anywhere from 6 months on to 4 years. Your MMR, which is your measles, mumps, rubella. Your varicella is for your chickenpox, and then you'll get your Hep A. And then between 4 and 6 years, you'll get your DTaP booster, your polio booster, which is your IPV, your MMR, which is your measles, mumps, rubella, and then your varicella. The majority of these vaccines are immunizations or injections into the arm or thigh. The only one that I can think of that's not, which is the liquid, would be the rotavirus, which treats the gastroenteritis so that they don't get stomach flus and have diarrhea and vomiting. So some of your duties as a medical assistant, if you're doing the immunizations, you want to make sure you're explaining the risk and benefits of the immunizations to the parents. Explain the side effects. They might be sore. They could have a slight fever after getting a vaccine. You want to make sure you're going over the consent form, that they are signing the paper allowing you to give the immunization, which is called informed consent. You want to make sure you're keeping the records for their immunization, such as the type, manufacturer, and lot number, making sure the date on the vaccine is not expired. You want to make sure you date the time that you did the administration of the vaccine, and then the name, address, title of the person who administered the vaccine. If it's you, it would be you as a medical assistant. And then the vaccine storage. You want to make sure if the vaccine needs to be in the refrigerator, that it goes into the refrigerator. If it doesn't, it stays out. Some of them need to be frozen. Some of them need to be refrigerated. So always make sure you know which one's which. You want to make sure you're rotating the supplies so that the shortest expiration date are used first, and then the ones with the longest expiration date you're putting in the back. So you're using the ones in the front so they don't expire, and the ones with the longest expiration date are going in the back. And then just make sure you're following all the infection control guidelines from preparing and administering the vaccines. If you need to wipe before, bandage, just depends on what the vaccine is and what the procedure would be. So pediatric screening and diagnostic test. You want to make sure you're taking vitals. The temperature should be the last thing you do to the child, most likely because they're going to cry or become upset. You don't want to do that first thing. Your oral thermometers are not appropriate for the use of children under the age of 5. You want to try to use the tympanic or the temporal because they're easier to use and they're safer. However, rectal thermometers are the most accurate. You're not going to use those unless you absolutely have to. Blood pressure, it's a little bit harder to get on the little guys. They usually weigh between 3 and 4. You want to make sure you're using the correct cuff, right size. You're going to inflate it up to about 20 mercury after the point at which you get the radial pulse. And then the same way as you do an adult blood pressure, it's just the same process for children. Just to make sure you're using the right correct cuff size. And then just some of the normal vitals. For a pulse, a newborn is higher. It's between 120 and 140. Infants is 100 to 160. And then as a toddler, it starts to get shorter or smaller and smaller. So by the time you get to an adolescent, your pulse should be between 60 and 90, and your respirations should be between 16 and 20. And then as part of your child's yearly checkups, the pediatrician will examine the interior of the patient's eyes using an ophthalmoscope, looking for signs of just correct structure, looking also for signs of amblyopia or lazy eyes or other conditions, which if they are caught early enough, they can be corrected. There is a Snellen test, which is the one that has the letters on it, that is used to check for your visual acuity. And then during the hearing exam portion, the doctor will check the internal structures using an otoscope. And then as they get older, they can do the audiometer, which tests for hearing deficits if there are any. If the patient is too small to perform the audiometer, the caregiver can clap or generate a loud noise, making sure the room's quiet, and then document the patient's response. That they turned, did they look, were they startled when they heard those noises, would be appropriate responses. Then your throat cultures. So you want to have the patient lay down rather than sit up. It does make the process a little bit easier. If you are trying to get it and the child refuses to open the mouth, do enlist the help of the caregiver first. They might be able to have some tricks up their sleeves. However, if they do refuse to do it, just kind of gently squeeze the nostrils shut. Eventually, they're going to have to open up their mouth to breathe. And then you just go ahead and swipe it there. Your blood drawing procedures. The heel is the most appropriate site for the infants due to the small size of their veins. If you are getting, drawing blood on an older child, you want to make sure that you're speaking to them directly. Speak calmly, soothing voice. Explain the procedure in terms that they can understand. And then make sure you give them a lot of praise upon the completion of the procedure. Common pediatric diseases and disorders. I did highlight 6 or 7 of these. such as asthma, your head lice, your herpes simplex virus, impetigo, pink eye, ringworm and pinworms, strep throat, and scarlet fever. So this slide here, when you have time, go through it and look at the descriptions. So I'll go over a couple of them with you. Like you have your asthma. It's inflammation of the airways caused by, outdoor or environmental triggers such as your animal hair, dust, mold, pollen. Also can be caused by viral infections. There are sport-induced asthma as well. It can include tightness in the chest retractions, shortness of breath, rapid breathing, and then being extremely tired. And then if you just kind of go through like the treatment for that, obviously stay away from those known triggers. Measuring the peak flow during northern breathing functions. Making sure you're taking your inhaled medications if needed, which is your corticosteroids or your leukotriene. They offer those quick relief syndromes, and then you can do your albuterol or your Atrovent or allergy shots and oral medications. So you can go through the rest of these for the other 1, 2, 3, 4, 5, 6, 7, 8. 8 of them. Go ahead and just make sure you are able to. You can use this slide here and then just write some of the symptoms and treatments along the side of it. And then your less common diseases that you might come in contact with. You have your AIDS. Most cases are transmitted from mother to their infant. And then you have juvenile rheumatoid arthritis, or JRA. That's an autoimmune disease of the joints that occurs in children 16 and younger. Then your attention deficit hyperactivity disorder, or ADHD. It can cause gross motor disability, the inability to read or write, hyperactivity or hyperkinesis, and a generally disruptive behavior. The inability to read or write is basically because they can't sit still or concentrate long enough. It doesn't mean that they don't have the ability to do it. They just aren't able to sit still and comprehend and concentrate. Cerebral palsy is a birth-related disorder of the nerves and muscles. It's the most common movement disorder in children. And then congenital heart disease. So that's caused by cardiovascular malformation in the fetus before the child is born. And then your Down syndrome, which is a congenital disorder resulting in one extra chromosome in each of the millions of cells formed in fetal development. You have your hepatitis B, which we have vaccines for that if you listen to the prior slides. That can lead to serious and chronic liver infections. And then you have your respiratory syncytial virus, or RSV. It's often seen in winter and spring. It causes, it's a major cause of the respiratory disease in infants and young children. Then you have your SIDS, or sudden infant death syndrome. It's sudden death of an infant, usually occurs during the sleep. The cause is unknown, and if it happens, it usually happens between 4 and months. They do have different studies now where they will tell the child to either sleep on their stomach, sleep on their side, sleep on their back. Don't put the bumpers in there. Put a bumper in there. Put a blanket on the child. They honestly don't know what causes it, but they do try to have different ways of avoiding it. And then spina bifida. That is a defect of the spinal cord in which the tissue and bones do not form or close properly. So if you see here, you have your spina bifida here, you kind of have like it's not formed all the way here. So you have like these little tufts that kind of come through on the back part of the spine here. Then a meningocele is when the spinal fluid starts to like bump out and make a big bubble. And then your spinal nerves pop out here when you have myelomengocele. So that your muscle and the meninges are kind of sticking out, making a big bubble, even bigger bubble. So one is just the spinal fluid, one is spinal nerves and the fluid, and then spina bifida occulta is when you have that hair tuft sticking through. Then you also have your viral gastroenteritis, which is inflammation of the stomach and intestines that can be caused by a virus. It's very serious in young children because it can cause extreme fluid loss, which then will result in dehydration and electrolyte imbalances. Pediatric patient special concerns. You want to make sure that you're able to detect child abuse or neglect. Possible signs of neglect would include a dirty or neglected appearance, hunger, extreme sadness, or fear, or inability to communicate. Always, always, always inform the doctor first. Do not assume or say something to the parents first, because you could possibly be wrong. So always inform the doctor first before he goes in to see the patient. Eating disorders, you could come in contact with anorexia nervosa. That's when the patient basically starves themselves by not eating due to a distorted body image. And then bulimia nervosa, that is a pattern of binge eating and purging or vomiting. Long-term use of this can damage their esophagus, their stomach. All the acids coming up from the constant purging can cause lifelong damage to their esophagus. Making sure you know the signs of depression, substance abuse, and addiction. If somebody is on any kind of narcotics, they get altered eating habits. They're sleeping too much, sleeping too little. Their weight changes drastically. Either they go up or go down since the last visit. Obviously, the bigger ones are if they slur speech, they're not making logical thought process, if they have track marks on their arms, or if their pupils are highly constricted or pinpointed. And then your violence, if there's frequent physical fighting, increase in risk-taking behavior, gang membership, trouble controlling feelings such as anger, they withdrawing from their friends. They can have violence if they're feeling alone or rejected, or if they've been a victim of bullying themselves. Failing to acknowledge the feelings and rights of others is also a sign of violence. And then your suicide. So according to the Centers for Disease Control and Prevention, suicide is the third leading cause of death for people between 15 and 24. Some of the warning signs would be depression, anger that's directed toward themselves, alcohol or other substance abuse, changing in habits such as carelessness, sloppiness, lack of interest in personal appearance, giving away personal possessions, or giving verbal hints or clues about committing suicide. And then you have to be aware of the sexually transmitted infections and pregnancy prevention. Since teens do engage in sex, you want to make sure that they're aware of the STDs that they can come in contact with and their effects on the body. They all should be able to know how about pregnancy is prevented. So making sure that you are honest with them, give them all the facts in that age bracket. They do tend to have less issues, but as long as they're informed with the proper information, you're doing the best you can. So that is our slideshow for Chapter 40, Assisting in Pediatrics. Thank you.